Hi guys, this is going to be a review session for your final exam. This review session is not meant to be all comprehensive, so it doesn't replace you studying the study guide on your own. Review the PowerPoints and the textbook, and especially pay attention to pathophysiology, recognition of a disease process, diagnostics and labs that are used to identify that disease process, review signs of a patient that is doing poorly, make sure you know the patient teachings for that disease process, including activity and dietary restrictions or recommendations, and for some of the disease processes, you might need to know a med. Usually I only pick a med if it's something we've discussed in class, though. Also, you would want to know if there's anything to do with operative procedures or treatments concerning that disease process. And that's about it. So that should get you in a good place. For musculoskeletal, there are a few disorders to know, which we'll go over, but also make sure that you review the 5 Ps for checking neurovascular status of a limb that's been casted or that might have an impingement of a nerve or blood flow. So make sure you're able to recognize, because that's a medical emergency and needs to be handled promptly. Also make sure that you review, for example, cast care, signs of infection that's maybe under a cast, developmental teachings for kids specifically related to casts. Braces are a big thing in this chapter, so make sure you go over those. Specifically, things to know about musculoskeletal is you should know if, how do pediatric bones differ from adult bones? So are they easier to break or harder to break? Is it easier for a kid to sprain, say, an ankle or an elbow than an adult, or is it harder? Is it harder to injure a tendon for a kid than an adult? Make sure that you are able to recognize signs and symptoms of fractures, breaks, compartment syndrome, and rhabdomyolysis. There's a couple of things that are specific to kids that you won't see much in the adult population with musculoskeletal. So for example, Pavlik harnesses. Describe what they are used for. What is the purpose of a Pavlik harness, a spica cast, and then back braces used for scoliosis in particular. What is the purpose of a traction device? And what are risks associated with using external fixation devices? As you know, that pins can be placed on a broken limb, and those can be visible to the outside, so there's puncture sites to take care of, wound infection risk, and then you need to troubleshoot if traction is actually working or not. Complications that can arise from traction devices or external fixation devices are possible infection inside the bone. That is very difficult to treat because bones aren't well vascularized, so it's hard to deliver antibiotics to the site. Discuss important teachings related to osteogenesis imperfecta, and teachings and screenings related to scoliosis. When our children are assessed for that, and what is the procedure for the assessment, and what age group. Also, rheumatoid arthritis is sometimes a disease process that can affect children because it is an autoimmune disorder. And so be able to explain the causes and the treatment for that. Usually comfort measures are what we're after. Growth, make sure you can recognize a child that is at risk for short stature. Be able to identify a few disorders that can cause short stature. Integumentary is important in this test that we're taking. So make sure that you can recognize the difference between a first, second, and third degree wound, a burn, and also know the difference between a partial thickness burn and a full thickness burn. Discuss treatment of a first and second degree burn versus a third degree or full thickness burn. And then also you should know that how we measure what percentage of the body is involved in the burn. So like 60% of the body, what does that mean? How would you prioritize the following interventions? So when somebody's burned or sustained a burn, the risks are first to the ABCs. The airway could be damaged from the heat or the soot, smoke inhalation. There's also evaporative fluid loss. And then also if the tissue that's affected, that fluid loss is just the contents of cells pouring out into the body. So consider shock, hypovolemic shock, hypothermic shock. When you lose your skin, which is a major job of the skin is to protect your temperature, then you're at risk for hypothermia. Then also if you're spilling contents of those cells out into the body, you would be at high risk for electrolyte disturbances, and all those are going to need to be prioritized in your mind from the highest risk to the lowest risk. And then that's just in the immediate time after the burn. Pain is a high priority also. Pain is especially important to medicate before dressing changes and activities. Consider fluid resuscitation as a high priority. In the next 8 hours after a burn, the risk for infection is very high because of the breakdown of the protection of the skin. So that would be a priority after about 8 hours. Then in the long-term nutrition, kids that are burned require a lot more calories, probably up to 4,000 calories a day they could need in order to rebuild all of their skin and still get enough nutrition for the rest of their body. Also, contractures can occur in the affected limbs, and dead skin removal. So any of the skin or muscle that's burned or damaged or necrosed has to be removed. And then we also have a risk of blood loss to extended portions of the body if you have a circumferential burn. So that's a burn that goes around the outside of the body, the outside of a limb, so it can cut off blood flow to the distal portion of that limb. So be able to recognize that as a risk. Other things that is on this test specifically is the questions about eczema and psoriasis. So make sure you know the difference and how do we normally treat those conditions, say with topical treatments. What are side effects of steroid creams? We've talked about steroid injections and oral steroids. There's also steroid creams, and what's the safety for the use of those. Also in this chapter, we have infectious lesions that you want to consider. We have, MMR, folliculitis, impetigo, pox, chicken pox, for example, and molluscum contagiosum. Also, basically any of the infectious diseases that are in the book are fair game on this test. Also, kids are at high risk when they're diapered for diaper rash, which is Candida. So how do you recognize a Candida rash in the diaper area? What's the cause? What's the treatment? And then also Candida can occur on the head area in small infants, and older kids are more susceptible to getting Candida in the groin, crotch area, the feet, and what's the treatment for that? Also in the Integumentary chapter, things you needed to know were identification of different types of acne. So there's hormonal type acne, there's infectious type acne. Some of them cause deep scarring and are more concerning. Others are just related to hormones and typically resolve on their own. Know the difference between comedones and papules, pustules, cysts, and what causes deep scarring and what's the treatment for that. What are the psychosocial components of concern with acne? And then important teachings to kids about proper skin care to prevent acne, or how to care for skin when you have acne. Those are important things. What kind of medications are used? And one specific medication that I'll bring your attention to, or actually more than one, there's benzoyl peroxide, trenitoin, isotrenitoin. Those are some of the big ones. And then oral antibiotics. I don't ask you what antibiotics, but just general considerations about oral antibiotics. And is there any particular medication that has a concern for birth defects? And I think you guys can find the answer to that one on your own, but make sure you're able to identify the safety precautions for that. Some of the common respiratory illnesses that we will cover on the test are croup, epiglottitis, RSV, pneumonia. So think of some of those, and then cystic fibrosis, which is a chronic illness. So that's kind of a review. The test asks you to recall some important information about vaccinations. So, for example, when do we give vaccinations? Do we hold them for certain things? For example, do we hold them if the child has a fever? Do we hold them if a child has been exposed to that illness? What are important patient teachings, and how would you overcome vaccination hesitancy in some families? What kind of teaching would you give to overcome that? Some test items that we have are on critical illness, and so questions are, relate to whether or not you should separate parents from children. How do you deal with upset parents in a crisis situation? And then continuity of care. So continuity of care usually refers to the idea that children and adults too, to some extent, when they have a critical illness, that it's important for them to have consistent caregivers, nurses, over the course of several days, so that they can get to know the nurse, and the nurse can get to know the patient, and that provides some comfort and also some important safety considerations, because the nurse doesn't have to relearn the whole chart every time they see the patient. Chronic illnesses, questions on the test about that have to do with maintaining normal routines, maintaining discipline patterns, consistent caregivers. So review the teachings on that. For neuro, some of the areas of focus are hydrocephalus, myomeningioceles, meningitis, head injuries, lung punctures, and then specifically signs and symptoms to recognize certain interventions that are appropriate, positioning that's appropriate, diagnostics such as, x-rays, MRIs, lumbar punctures, recognition of worsening condition, especially with head injury and hydrocephalus. How should pain be medicated for in head injury patients? How about pre and post-operative care for kids that have various neuro conditions, especially hydrocephalus? How do you troubleshoot a shunt, for example, and what signs and symptoms would let you know that a shunt is malfunctioning? Some important disabilities to review for the test are Down syndrome and autism, and some learning disorders are important to know. Make sure you're able to discuss socialization and normalization of learning for those children. Recognition, especially with Down syndrome, there's some physical manifestations that you want to be aware of. There are some endocrine items on the test. Particularly, you want to review some endocrine disorders related to a growth or stunted growth or rapid growth. So hypo or hyperpituitarism and precocious puberty are important ones to focus in on. Recognition in the pediatric population of type 1 and type 2 diabetes are very important. Most of the questions are going to revolve around type 1 diabetes because that's the more common type of diabetes that pediatric patients get. Make sure you review recognition of diabetes, including the 3 Ps. Make sure that you're able to differentiate between high blood sugar and low blood sugar. As far as treatment, remember, hot and dry, sugar's high, cold and clammy needs candy. So that is one way to help remember the signs and symptoms differences. Also remember, like, priorities in ketoacidosis. We're going to have to replace fluids, potassium, and then give insulin. So possibly if they're in the ICU, they'll need an insulin drip. But if children are outside in the home setting, how do they prevent getting into ketoacidosis, especially if they're in sports or doing physical activity? How do they prevent getting into a low glucose state? What do they do on sick days? What should you do as far as your assessment items for rapid recognition of the disease process that the child's in? And then for type 2 diabetes, you would want to know recognition. I would apply whatever you know from the adult world for type 2. Diabetes insipidus, the thing that students always forget and miss is that it's only 2 of the 3 Ps. So polyuria, polydipsia, there's really not any polyphagia related to diabetes insipidus. And then talk about recognition labs, that diagnostics, patient teachings are important for that disease process as well. Make sure for genitourinary that you go over nephrotic syndrome. Specifically, make sure you review the side effects of IV or PO long-term prednisone treatment, and make sure that you know the patient teachings related to that. Treatment for edema in children, activity restrictions, fluid restrictions, nutritional teachings as far as protein and fat intake, and then just make sure you know that one really well. For cancer, you're going to want to review Wilms tumor and leukemia really carefully. Make sure that you're aware of labs for chemo. Kidney masses, whether you should massage or palpate them or use hot packs or ice. And then, you know, what is the what is the likelihood of early recognition versus late recognition of Wilms tumor? For leukemia, you want to know what are the presenting signs and symptoms of that, what are signs and symptoms of bone marrow failure, and how is leukemia diagnosed, what's the treatment, what's the long-term prognosis, and what are some important teachings related to leukemia, especially with the family. And that's it for now. That's all I have. I hope this review helps you study for the final a little bit, helps you focus on some of the more important areas to cover. Have a great weekend.